Welcome to my channel with Pharma. Gastrointestinal Pathophysiology Part 3. Let's talk about peptic ulcer. Peptic ulcer. Pathophysiology. Peptic ulcers are open sore that develop in the lining of the esophagus, stomach and upper portion of small intestine, which is known as the following. Esophageal ulcer. That occurs on the inside of esophagus. Gastric ulcer. That occur on the inside of stomach. Duodenal ulcer. That occur on the inside of the upper portion of small intestine. The stomach is the organ of the digestive system in which food travels from the esophagus and is further broken down before its nutrients are absorbed in the small intestine. It produces acid and various enzymes that break down food into simple substances. The inside wall of the stomach is protected from the acid and enzymes by a mucous lining. Ulcers are caused when there is an imbalance between occur when the lining, specifically the mucosa, is damaged or inflamed, usually by the hydrochloric acid in the stomach. Peptic ulcer is caused by following. Helicobacter pylori bacteria enters the mucous layer of the stomach and attaches to the stomach lining. It causes the stomach to produce more stomach acid. This damages the stomach lining, leading to ulcers in some people. Second is the use of the regular non-steroidal anti-inflammatory drugs. Peptic ulcer disease is a well-recognized complication of NSAID use. Inhibition of COX-1 in the gastrointestinal tract leads to a reduction of prostaglandin secretion and its cytoprotective effects in gastric mucosa. This therefore increases the susceptibility to mucosal injury. Third one is the use of medication such as anticoagulation and selective serotonin reuptake inhibitors, SSRIs. Sign and symptoms of peptic ulcer: burning, dull pain, bleeding, weight loss, burping, bloating, nausea, vomiting, loss of appetite, heartburn, fatigue. Risk factor are the following: smoke, alcohol, stress, eating spicy food. Diagnosis is done by the different ways: upper endoscopy, upper gastrointestinal GI series, Helicobacter pylori lab test, biopsy. Treatment is done by the following method: use of medication, surgery, medications that block acid production and promote healing, medications that protect the lining of your stomach and small intestine. Peptic ulcer can be prevented by avoiding tea, coffee, alcohol, tobacco, cigarette, aspirin and other NSAIDs. Last one is the complications of peptic ulcers, which includes internal bleeding, perforation, obstruction, gastric cancer. Thank you for watching. Don't forget to like, subscribe and share.